I think I wanted to go into medicine even when I was a young kid. My dad was a physical therapist, so I had a lot of exposure to healthcare. And as I, got exposed more and learned more about it, I really liked the aspect of actually being able to make an impact on people's lives, kind of on a one-on-one basis. I think there's a lot of jobs where you can do where you help people on the whole, but it's not as concrete. You can't say, there's the patient that I personally helped. Gastroenterology, I think, is a fantastic field to be a part of. It's one of the few things in medicine where you really get to do, surgical procedures, but still maintain a lot of the kind of academic, thoughtful quality of medicine. We don't just do colonoscopies and endoscopies and ERCPs. We diagnose what's wrong with our patients. We direct their care. We manage, how they can get better. And I think a lot of things in medicine now, if you're an internist, for example, you do a lot of thinking, but you don't get to do a lot of doing. You don't get to be a part of the fixing of things. Whereas if you're a surgeon, again, you get to do a lot of the fixing of things, but you're not maybe necessarily doing as much of the thinking. And so I feel like gastroenterology is a real bridge between the two. I think that we all imagine ourselves as having a healthy diet. We all, when we look back retrospectively, we always think, I eat pretty well. I remember eating some vegetables last night, and I try and get some protein in and whatnot. But I think taking a real close look at the types of food you're eating, the frequency that you're eating. Unfortunately, obesity is such a big issue in our society right now, and food is so available, and particularly food that's full of, trans fats and all these other processed ingredients. Trying to base your diet, your life around some sort of whole food strategy is going to be better not just for your gut, but really for everything else. Reshape is an endoscopically placed balloon procedure that's used for weight loss. This is something that we've been doing here at Gastroenterology Consultants for the last 2 years, and it's been very successful. During this, it's essentially a one-year program. Patients first consult with me, and we kind of go over what it all entails. They have a procedure where these balloons, and you can kind of see it in the model here, there's 2 balloons that are essentially placed in the stomach during the course of an upper endoscopy. So they're asleep. While they're asleep, I use a camera, go through their mouth, look at their esophagus, stomach, and small bowel, then place the balloons. These balloons give a sensation of fullness, so people feel satiety earlier. It allows them to learn a little bit more about their cues for when they're full, and it allows them to kind of change a lot of their behaviors that cause them to gain weight in the first place. While the balloons are in place, and then for 6 months afterwards, they work with essentially a health coach, a dietitian who helps direct what sort of foods they need to be eating, what sort of behaviors they can change to potentially improve not just their health, but not just their weight, but their health as well. And then after 6 months, the balloon comes out, and there continues to be counseling after that. And we've been, very successful. I think the patients that have gone through the program have been really happy. Typically, they lose 35 plus pounds and have kept it off, which I think is the really important thing. It's a great tool that we can use that's kind of outside of the more radical things like bariatric surgery, or of course the dietary modifications that people haven't been as successful with.